Aloha! I'm Dr. Catherine Taketa-Wong, and part of our mission as a doctor at our office is to educate and empower as many people as we possibly can with their health. So I'm glad to be with you for today's very important Facebook Live event because it's about the value of an integrative approach to caring for patients. And what does that mean? First, it means that we consider lab tests, nutritional improvements, specialized supplements, herbs and pharmaceuticals when necessary, but also acupuncture, which we also practice. In addition, it means that we regularly recommend our patients to other types of practitioners, including psychologists, lactation consultants, behavioral therapists, psychiatrists, and other specialists who work with them on behalf of the patient. These are cutting-edge practitioners who offer the latest medical technology, advanced techniques, and new therapies. Many physical medical conditions have a mental, emotional, or psychological component. So for example, anxiety can be caused by thyroid problems. So doctors can treat the thyroid condition while therapists can help to resolve the anxiety. So to illustrate the importance and value of an integrative approach to our medical care, our featured guest today is Kelsey Wright, MS, LMFT. And so welcome, Kelsey. Very happy to have you here, and thank you so much for joining us.
Thank you for having me.
Yeah. And so Ms. Wright has a master's in social work and is a licensed marriage and family therapist. Her daughter has had developmental delay and difficulties with mood, attention, and social interaction. Her daughter is being treated medically by me, while her mother is also working with her at home, using her knowledge as a therapist to help her daughter with her condition. Ms. Wright specializes in helping people with anxiety, depression, and PTSD resolve the issues that are hindering their growth and enjoyment of life. Among the cutting-edge therapies she uses, we will focus in this event on EMDR, which stands for Eye Movement Desensitization and Reprocessing. Eye movements are used to help resolve certain traumas much faster than traditional approaches. How? I'll be asking her that very question. But first, just a few words about our practice at Dr. Catherine Taketa-Wong Associates. At our naturopathic practice, our mission is to identify and heal the causes of an individual's condition by combining highly advanced science and cutting-edge diagnostics with natural remedies, both modern and ancient. Many patients come to us from regular practices because they're tired of the shortened visits and the prescription drugs with their side effects. My specialty is the medical treatment of autism, ADHD, and other special needs. Our other two doctors specialize in women's health, autoimmune diseases, weight loss, gut health, and other complex conditions. We welcome new patients, and to make sure our practice is the right choice, there is a no-charge phone consultation with me in advance of scheduling your appointment. So this is so that I can talk with you personally about your concerns. So phone and other contact information is on our Facebook page. So again, this is Kelsey Wright, a psychologist that I refer patients to. We'll be talking about her daughter, who is my patient, and also receiving some therapeutic techniques that Kelsey uses with her at home. So Kelsey, first, could you talk to us a little bit about the kinds of therapies that you use in treating your clients?
Yeah, I like to integrate multiple approaches for kind of a more holistic stance, tailoring it to whatever the client needs. So that might be cognitive behavioral therapy, DBT or dialectical behavior therapy, solution focused, and EMDR.
Yeah, great. Let's just talk about eye movement. And actually, is there a light? Like, would we be able to turn on a light or get the light so we can see your face just a little bit better? Yeah.
Not the most pleasant light, but that's okay. Is it a little better? Kind of?
Let me see. A little bit. Yeah. So, okay. Okay, great. Let me see. So, Let's talk about the EMDR, the eye movement
Mhm.
desensitization and reprocessing. So that is a therapy that I have seen some. I've been very impressed with the results that I've seen with patients, particularly patients with PTSD or post-traumatic stress disorder, anxiety, and depression. And I think it's really fascinating. So, can you explain a little bit about EMDR, what it is, and how it can help people?
Yeah, it was originally developed for PTSD to treat folks with symptoms that align with that disorder. But I would say that most clinicians that use it nowadays implement it for any type of challenges, like you said, anxiety or depression. Um, any types of, you can call it like the big T's, big traumas, like incidents or events, but also the little T's that most everyone experiences at some point.
Mm-hmm.
Um, so yeah, it's bilateral stimulation with eye movements. So you move your eyes back and forth or tapping. There's different ways of utilizing the back and forth, and it mimics what our brain is doing during REM sleep. So just lots of processing and assimilating and kind of digesting information. Um, and with people that have PTSD, for example, some of that information hasn't really been, I guess, processed in an adaptive way.
Mm-hmm.
So it just kind of helps. If it's lingering around, information or memories or parts of past events, it helps make them more distant or less bothersome to the person, if that kind of makes sense.
Mm-hmm. Yeah, yeah. And I've seen with patients, sometimes patients who are sometimes really stuck, you know, with the symptoms that they're dealing with PTSD or just anxiety, depression, and it's really interfering with their life. And I've seen patients that go through EMDR, and sometimes that can really lead to this breakthrough. And for my part, you know, at our practice, we're doing some of the medical things, like I said, you know, trying to address if there's nutrient deficiencies or thyroid or hormone imbalances or toxins or whatever else that's going on. But it's like sometimes patients are still just really stuck because of that trauma.